and I'm the president and CEO of the Opportunity Alliance located here in South Portland. And this morning we're gathered for a virtual press conference really to share some information about some of the most critical services really in our area, but also across the state that we think are really important and relevant at this time as we continue to sort of live day to day with the COVID-19 pandemic and enter into the holiday season. It's going to look a little bit different. People will likely not be able to be with their family across the country or other parts of the world. So it will be a different holiday season for sure. But we think that this morning we have some outstanding professionals that work for members of the Behavioral Health Community Collaborative. We're going to talk about their work and their experience in their roles. So just quickly, let me introduce the Behavioral Health Community Collaborative. We are a local coalition of 7 community-based mental health substance use organizations, including Kids Peace, Oxford County Mental Health, Shalom House, Spurwink, Sweetser, the Opportunity Alliance, and Volunteers of America. So these organizations have been working together for many, many years and have a significant impact on the lives of Mainers. So without further ado, I think I will invite Tracy Malwitz, the director of the Maine Crisis Line, to talk about what's going on at the crisis line, the Maine Crisis Line, and what you're seeing, Tracy. So we'd love to hear from you. Hope you're on mute.
Hi, I'm Tracy Malowitz. I'm the director of the State of Maine Crisis Line. And I just would like to share that since the pandemic has hit, we've seen an increase in calls as well as intensity of the calls. We have call specialists that are answering the line 24/7. We also have a text chat line that people can access. And so during this time, we have been seeing an increase of anxiety and depression, loneliness and isolation. A lot of folks are really worried about money and food and job loss. And with the holidays coming up, there is more isolation and concern about folks not being able to see family members. So we provide someone on the other line, a warm, friendly voice that's trained professional who can help either help somebody in the moment or access our mobile crisis teams or our warm line or other organizations within the community that can help them. And we work really hard to, provide that support. We're seeing more and more people that have never experienced mental health issues that are calling our line now, really like for the first time with experiencing this anxiety, this stress, this unknown of the virus and how long it's going to last. So it's a very simple thing of picking up the phone and calling us, and you'll be met with, like I said, a very kind and trained individual that can help people in the moment.
Great. And could you tell us how to access the Maine Crisis Line?
Sure, you can call our line, which is 1-888-568-1112. You can also just plug that into your phone and text that. You can text to us as well as going to our website, and you can chat with us. There's an icon to hit where you can access the chat line.
Perfect. Thank you. Thank you so much. So let's move over and talk to Scott Metzger, who's the director of the Intentional Warm Line, and hear what's going on in that program across the state. Oh, you're on mute, Scott. Sorry.
Wait, no matter how many times you do that, that trips you up, doesn't it?
Definitely does.
I don't feel alone. So, and that's actually part of the warm line, is just not feeling alone for people. I mean, if I really had to sum it up, it's that people are out there, they're experiencing difficulties, and they think that they're the only one. What we do is we hire peers, people who have a background with mental health issues, substance abuse, or trauma, and we train them in intentional peer support so that when you call our line, you're met with somebody who has really probably been in your shoes or something close to your shoes before. They've dealt with substance abuse. They've had the highs and lows of mental health. The difference, hopefully, is the people we hire are already on a pretty solid journey of wellness and recovery. And so it's a matter of kind of being able to reach back and support others as they're beginning that journey. They may not even know that that's possible at that point. We, just like the crisis line, are 24/7, 365. We cover the entire state. And we only work with adults, though, 18 years or older. But there's no barrier in terms of insurance needed. In fact, we're not even required to give your first name if that's something you want to hang on to until you feel more comfortable. And when people call in, what they hopefully experience is somebody who's able to listen and provide validation without judgment and just meet people where they're at in that moment. Try to give some hope. If they walk away with any amount of hope, then we've probably done our job, even if it's just for the afternoon. People will call back a couple days later and say, hey, this worked, this didn't work. And just the other day, a guy called after he hadn't called us in 7 years, and he had been a long-term caller before that, had issues with alcohol, and he called back to say he'd been sober that whole time and was living his life. And that's really what we try to do, is help people move towards the life that they want, and they get to determine it, not other people. The pandemic, we are up almost 60% in volume since the pandemic began. We did expand with the help of the CCP, our staff, to be able to handle that volume. And we're seeing a couple things. Is it kind of peaks just like the virus, kind of, you'll see the peaks, so do people's anxiety. And it was kind of in a lull, and now we're getting hit with a big whammy because you had the politics in the nation. We're really getting people, energized. We now have some peak in cases, and you've got the seasonal change, and you're going into the holidays. And so we're seeing some increase in, kind of anger, fear, and even some, I'll say, anecdotal substance abuse use increasing. So I think we are really at a tricky part right now, because all these things are coming together really not at a good time. So, and seasons affect people very heavily that call us. Mm-hmm. So that's a big part of it. And as far as accessing us, maybe Gabe can throw that up. I also have the number here. Let's see, the 866 number. And I don't know, Joe, what did I miss that you might want to ask me? Did I miss anything?
I think I may have a couple questions that we'll come back to you. I think that was really
okay.
Good. Jake
good.
Just put the number 866-771-9276. That's the access number for the Intentional Warm Line. Amazing folks work there and do great work. So we encourage people to call. And
there's one other thing, Joe, I just want to say, I'm sorry, that these lines don't all work in isolation. There is collaboration between them. When we have someone that is beyond what we can do, we have the crisis line with Tracy runs to be able to send people to, and vice versa. When they have somebody who needs more to talk than necessarily be, put through some type of analysis, or where they need to go to the hospital, they send them to us. So I think it's really, and 211 is a huge piece of this too. So I just want to put that out there, that all these lines are not working independently. There's a lot of collaboration among them. Sorry to interrupt you there, Joe.
No, that's really good. Really good. Thank you. That's great information and really important. So Gabe, tell us what's going on with the Kids Piece and Alternative Response Program and how you're working with children and families.
Hi, thank you. So my name is Gabriel Smith. I'm a case manager with Kids Piece and what's called the Alternative Response Program. We actually respond to mild to moderate reports. They come into the department, to the Office of Child and Family Services. But we're called the Alternative Response Program for a reason. Generally, our first task is to just ensure, or to assess and connect with families and just, make sure that kids are safe. But beyond that, we really look to try to support families and to help them through strength-based approaches to try to look at, what challenges exist in their family, whether mental health, substance abuse, or other, and then to try to help them access the services, supports, programs, and things that are available, resources that are available in the community. You know, I spend a lot more time, it seems, doing that. You know, there certainly are circumstances, you know, where kids are in a tough spot and we have to, you know, get back in touch with the department or do whatever. But ultimately, you know, the value I find in the work that we do is trying to help families. I'm in Lincoln County most of the time. Certainly parts of Lincoln County are quite rural. And so really it's about just trying to, much like Scott said, just trying to come alongside families, trying to support them without judging them, trying to give them, you know, the opportunity to tell me, you know, what their challenges are, and then to try to look into, you know, what's available to them. And we certainly use 211 to help them find services and many other resources. And, you know, I see a lot of the same thing. I mean, I think, you know, I see my role sometimes, you know, I'm sort of a first responder in some ways. You know, some of these families, I meet with them, and, you know, some of them are engaged with many different services and some are engaged with none. You know, I think families that were sort of isolated previous to COVID, that were experiencing mental health challenges, substance abuse challenges, you know, whatever they might be, that, you know, the stress and anxiety mentioned before has just, you know, compounded their challenges. And so, you know, I think it's important to recognize, you know, the stress and anxiety for families is coming from so many different directions, whether it be a lack of, you know, collaboration with schools or access to services at schools in the same way that families are used to, or whether it just simply be isolation from a lockdown. I mean, the stress is just increased, and it certainly hasn't lightened up. And to another point, you know, I think with the holidays coming, the holidays is traditionally a tough time for families that we work with. And I can't imagine, you know, that this current situation isn't just going to exacerbate that for them.
Great, thank you. A perfect segue, I think, into we're going to hear from Kristen at Oxford County Mental Health, and I believe you're going to talk about mental health crisis services. So Kristen, what's happening in that program?
Hi, so my name is Christian. I'm from Oxford County Crisis with Oxford County Mental Health Services. So some of the things that we've been seeing, a lot of our area is pretty rural, and a lot of our clients are already pretty isolated. So some of the things we've seen have just been an increase in some of the struggles we already deal with. So for example, like looking for inpatient hospitalization has been increasingly difficult. A lot of the hospitals take from their own EDs first, of course, which has always been the case, and then like sister connected emergency departments. And one of our emergency departments, which we serve, doesn't have like a sister hospital with inpatient psych. So that hospital has seen really long waits for clients sitting in emergency departments, like sometimes even like 2 weeks before we can get placement. We've seen an increase in struggles for our elderly. So with COVID, people are trying to be really careful with the elderly. So a lot of people are taking steps back from seeing them in person. And so they're getting a lot of phone contact. And so they're feeling a lot more isolated than they were previously. So we've seen a lot of increase in that kind of depression. And then we've seen an increase in difficulty for kids ages like, I'd say 14 to 16. And like with significant things like requiring hospitalization. So that's an area that's been very difficult. And the kids in particular also are very isolated. So they're not getting that social interaction. A lot of kids are remote too. So that's been really hard on them. Same things we sometimes deal with, but like transportation's difficult. So a lot of places are requiring COVID testing, which a lot of people are scared about. So that's been a barrier. And then getting transportation to COVID testing, getting the approval from their primary care provider. Those have all been increased struggles for the people that we serve in our area. Yeah, and then on top of all that, I'm sure all of you guys have come into contact with the wait lists for counseling in particular. So a lot of places you're looking for adults, it's like 10 weeks in some places. With kids that we work with, you're looking sometimes more like 6 months because there's just less people that serve that age. So those are kind of some of the difficulties in the rural area with the connections that we have here and the large amount of people that are now needing supports with all the agencies and places that are already serving as many people as they can. So that's an update here.
Sounds like you're really busy, but doing great work. That's great. Do any of the panelists have a story? I know, like, sometimes putting a face to the challenges. Does anyone have a situation that puts a face to our work?
I have a story. We get a lot of callers that will call and let us know how helpful, or family members that call us to let us know how helpful it was that we're actually there, that there's someone there picking up a phone on the other line and talking to an individual who's really struggling. So we recently had a caller who is homeless and has cancer, and definitely battles depression with all of that. And he, called us and said that really for the last year without this line, he's not sure how he would have made it this far. He has no family members and very little friends to access help for, like, when he needs it. And just having someone pick up and talk with him for just a few minutes has really helped him just get through those difficult times.
Really good, really good. Thank you, Tracy.
I think one of the things, I'm sorry.
Go ahead,
Okay.
Scott.
Yeah, I think, well, this isn't a particular person. This is kind of the event that really touches us and the staff a lot, is when we get that person who's never called anytime, anywhere. They've never called crisis. They've never called the warm line, and they somehow get the number and they call. And it's like a one-off, but they call, they talk for 20 or 30 minutes. They say, I got what I needed, and you may never hear from them again. And I think those really touch us because those are the people hardest to reach, those ones that when they need it, know how to access it. And so when we get those, we always want to know, how do we access more of those? The people who call more often, they've already connected into the system. These other people somehow are not connected. And so we're glad they get what they need, but we'd love to reach more of them. So the staff always get a really positive feeling from those folks that they're able to make that connection short term. And it's kind of like send them on their way. And it's a good thing we don't hear from them again, not a bad thing. So
Yeah, really great. Good
Yeah, I
information.
think if I could interject, one of the nice things that we've done or that's happened during this pandemic is that I think family members and friends are seeing people more, hearing from them more, they're around them more on a daily basis. So we're getting a lot of third-party callers. And so even that avenue of a family member reaching out because they're concerned about their son or their daughter who lives in another town over that they haven't been able to see, but they're concerned. And so we can connect them with services as well. And then we've also made that line in with the third-party caller. So we have seen a rise in calls from third parties.
Interesting. Is there any questions that the press has of the group, of the panel? I'd like to open it up for the questions.
Yes, if you're a member of the press, you can just switch on your audio or your video and put the little mark, raise your hand with a little reaction thing. And we'd love to have your questions. And then we'll go with some more resources.
I have a question. This is Eric Russell at the Portland Press Herald.
Hey, Eric.
Couple questions, actually. I wanted to see if you had some more specific numbers about calls to the various hotlines. I think Joe or Tracy had mentioned some, that things have increased in intensity, but I wonder if she had any numbers specific to that. And I think Scott also talked about an increase of 60%, but I didn't know if you had some actual hard numbers that we could reference.
I do. So last year, the year before the pandemic started, the 12 months, we did a little over 25,000 calls. and they're at 22 minutes each is our average call. So it's a little bit longer than like a crisis call because you're creating that connection and so on. And since the pandemic, the exact number is 58% increase in the talk time. And I could get you breaking that down if you'd like through Susan Piardo, we can get you that.
Okay, that's great.
Yeah.
And Tracy, did you have some specific numbers?
Probably we can get that to you. I don't know if Joe, if you have that handy. I just know that the increase has been, we also get calls from the national line. So it's Maine folks that call the national line, and that's looped in, and that's relatively new as well. And so I would say just an average of answering calls per day, we average around 200 to 300 calls a day. But we can actually get you percentages unless, Joe, you have that available right now.
Yeah, no, we could definitely get more information, Eric. The call volume has significantly increased, and it really depends on the day, but we can sort of send that back to you because I think it is interesting information. And compared to 211, I mean, 211, their call volume has really, really increased because they're the front line in many ways, or many services that are happening, but both the programs, and we can get that out right after this to you all.
Okay.
Yeah, and I'd like to add that the intensity of the calls have changed tremendously. So it's not, a 6 or 7 minute call. Typically now we're running into 15 to 20 minute calls as well, which, is makes us busier. It's definitely a busy line.
And one other question, if I may, and I don't know who might be best suited to answer this, but I know early on in the pandemic, there was a lot of resources and federal money that came in to support some program efforts for mental health agencies. And there hasn't been a stimulus package, as everybody knows. And I wonder if there's a financial crunch that's hitting some of the organizations that are represented here.
Yeah, so we have sort of been taking it like day by day, and we, like probably most businesses in Maine, are concerned about sort of the year ahead of us, as the state of Maine, which is largely funds a lot of our work, is impacted. We anticipate that we'll be impacted. Right now, I think it's more program by programs that have been hit financially. So a program might be holding its own while a sister program might be struggling. I think for the Opportunity Alliance, our concern is about the future and what that looks like with funding from both the state and federal government. But so far, we've sort of been weathering by making, being very creative with staffing, people working at home, reducing expenses. But at some point, those strategies aren't effective enough anymore. So we'll work closely with the legislature and the department throughout the next few months.
Thank you.
Hi there, Jackie Mundley from News Center Maine. I just had a quick question. Obviously, mental health has been hard for everyone with the pandemic and things like that. But I remember doing a story this time last year about mental health around the holidays. It can be really challenging for people who have lost a loved one, to have the first holiday without them. What tips do you give people, heading into this very unique holiday season?
I didn't catch the last sentence. Could you say that again?
Sorry, what tips or advice would you give to people that are heading into the holiday season who are really, truly struggling?
Well, I'm just going to say one thing I think both Gabriel and Kristen highlighted, which is isolating and being and not having that connection. Because I look at it in Maine, we somewhat have a geographic isolation to begin with. And then you add in mental health and the COVID and so on. And people, I feel there's a lack of connection many times. And think about getting together for Thanksgiving dinner. So not everybody has Zoom to be able to get together and make that connection. So whether they can reach out to a line to just talk to somebody, or somehow we can support them to figure out how to connect with their family or friends. I think that is a big piece of it, is we hear.
I would agree. I would piggyback off of that and trying to create the atmosphere of the holiday that you would go along with it like normal, as normal as it can be, but also just making any effort you can to reach out to family and friends by a phone call people you haven't talked to in a long time, just connect. And then if you're struggling with that, then obviously our lines, the main crisis line and the warm line are there to help as well.
There is
Jake.
one really creative thing I heard last week, at least I thought it was creative, is that a woman who does not have a family is holding some Thanksgiving check-ins at 2 or 3 times on Thanksgiving Day for anybody who wants to join her. And it's mainly oriented towards peers around the state. But what if people could do that, and hold something for others? I just thought that was really a neat way of approaching it, and trying to bring the community together.
Jay, can you put up Kids Piece, their graphic? I think it's very helpful and informative. And Gabe, I don't know if you could walk people through it. And again, we can send this out, but it's building off of personal protective equipment, and you really can see the categories that people need to focus on in terms of tips.
Yeah, this is Betsy Sweet with the Behavioral Health Collaborative. And so if you look at these are things specifically to your question that people have to pay attention to during these holidays. Get good sleep. It's really hard to sleep sometimes. It's anxiety producing. Stay hydrated, eat good foods, do some coping skills, get outside, breathe, sometimes writing things down. Certainly around the Thanksgiving holiday, writing down your gratitudes, all the things you're grateful for. Sometimes we concentrate on things that we are missing and what we're lacking, and that's easy to do in this particular holiday. But if we can switch our focus to what we are grateful for and what we are, what things still are wonderful in our lives. Stay away from the media. Don't saturate yourself. The media is now full of bad news. So, please stay away from that. Talk to your friends. Again, get your relationships, whether it's counselors or friends and family or virtual visits with people, as Scott mentioned. And then please don't be afraid to reach out for mental health help. One of the issues is people think, oh, that's embarrassing. I don't want to do that. That's why we have the warm line. That's why we have 211. That's why we have the emergency crisis line. There's no shame in reaching out and asking for help. And that's why these incredible people are doing this incredible work. So this Thanksgiving, remember what you're grateful for, concentrate on what you have, get outside and connect virtually with the people that you love, and reach out for help if that's not enough.
And I would just say, thank you, Betsy. I was having trouble seeing that visual. My screen's not big enough. I think, I think this is a really neat chart because it talks about just really practical ways to approach mental health. I find that a lot of the people that I engage with are, it's crazy. I meet with families that, to most people, they would say this, this family doesn't have a lot of resources. They live in isolation, and I go and I meet with them, and they're more worried about the next person. They're actually saying, like, I know that I'm having a tough time, but I know that there's people out there that have it worse than I do that could utilize these services, and I don't want to, strain the system. And I tell them, these services are for everyone. If you need help, if you need support, these services are here for you, and you just need to reach out. But I do think that this is a really helpful thing when it comes to just getting through each day. And I can speak to that social media piece. I mean, I'm sorry, the social media / news media piece, and it can just be overwhelming, no matter what your beliefs or ideologies are. And for someone who's sitting in isolation, I find everyone these days has a TV almost. And a lot of these people that are in isolation are spending a lot of time, watching the TV, and what they're seeing can exacerbate their stress and anxiety. And I think that seems, obvious, but I think, you have to be conscious of it. And certainly as it gets colder outside, it will become more difficult, to get outside and exercise and do those things. And so I try to work with, families around thinking of creative creative ways, to get their blood pumping, inside of the home or whatever. And so, I think each family I work with, each individual I work with, has unique challenges, and they're certainly not all the same, but these are just very practical ways of approaching, trying to help yourself a little bit, and then obviously reaching out to services if needed. And we certainly talk about the crisis line 211 warm line, and just make sure that a lot of people don't even know those numbers exist, or they just sort of, to someone else's point, they just don't see it as something that they would ever use. And so sometimes I find myself just trying to encourage people to just give it a try. Just call the warm line one time and see how it feels, sort of to Scott's point. And, if it's not for you, it's not for you. But give it a try, and then just letting them know that those services and supports exist is a piece of it too. A lot of people just don't know what's out there. So.
Thank you, Gabe. That's really helpful. I think a perfect segue, Jake, to the Behavioral Health Collaborative's website, mentalhealthformaine.org or forme.org. If you can put that up, Jake.
Meanwhile, are there other questions? Any questions? Other questions from the press?
I have one more specific question regarding our elderly. Obviously, a lot of assisted livings and nursing homes aren't allowing their residents out. And just what type of effect are we seeing on our elderly? Are their, pre-existing conditions diminishing any faster or anything like that?
Go ahead. Sorry.
I was just going to say that from in crisis, we have seen an increase in seeing some of our elderly that are having a really difficult time living at home. Also, I have a coworker who works crisis and also works in the hospital setting. And of course, hospitals are monitoring who comes into the hospital to visit people. So there are some elderly who are, in end stages of life and very difficult times who just aren't able to see like their grandchildren and things like that. So I know that has been a real strain on a lot of elderly in the community.
And for the hotline, we're not, the crisis line, we're not seeing or hearing from a lot of elderly as much as we're hearing from family members who don't have access to see them, especially with the holiday coming up. But just, the grief that goes along with that, and the fear that goes along with that, and, just really trying to help support them in any way that we can. It's definitely been wearing on a lot of families.
Okay, any last questions before we end?
Can I just say, this is Betsy Sweet again. Let me just say that if you look on this last screen, if you go to our website, mentalhealthforme.org, you'll be able to pull out all of the resource sheets that we shared here today. Susan will get back to you with some of the numbers that you wanted, but anything you can do to help us let people know that there is information out there, that there is help, and that they don't have to go through this alone is the most important thing that we have. And please access this as you want, and please reach out if you have further questions.
So in closing, a huge thank you to everyone who joined our virtual press conference this morning. And we appreciate you taking the time.
Thank you.
Thank you.
Bye-bye.
Thank you. If the participants want to hang on, we'll talk for a second.
Yeah.
All right, I think that's us. Awesome.
Betsy, I'm gonna stop recording.
Okay. Oh yeah.